guys, welcome back to my channel. If you are new, my name is Savannah, and in today's video I'm going to be talking about my dog Gracie's health condition and her diagnosis. So in today's video, I just want to give an update of Gracie's health and what is going on with her. I am trying to include her in this video, but so far she's not having it. Also, I have Miss Everly here with me. She hasn't been feeling 100%. She's a little congested, so there you go, Gracie. So the only place she will sleep right now is on me, so we have Everly joining us for today's video. First of all, Gracie is our older rescue dog. She is about 12 years old now. I'm not really sure where to start with this. I guess maybe I will just start with what we noticed different in her and what happened when I took her to the vet last week. So shortly after we had Everly is a month old, we noticed that Gracie was coughing here and there, but we honestly didn't really think much of it. It was a hacking type of cough, almost like she was trying to clear her throat. And I mean, lots of dogs do that all the time. They kind of cough up phlegm here and there, and they need a drink of water, and then they're fine. So we noticed that Gracie was doing that here and there, but it honestly wasn't really alarming. The one night we were laying in bed, and Gracie was coughing like that over and over and over. And looking back, we actually feel bad now because we turned over to Gracie and we're like, just go get a drink of water already. Go clear your throat. But it turns out she wasn't just needing to clear her throat. Over the next few days, she was coughing more, and I kind of just kept an eye on it. I noticed that it was more hacking than normal for her. And then the one day, again, she was resting, laying in bed. She started coughing a lot, and she almost couldn't really get comfortable. And then all of a sudden, I'm gonna call it my intuition because that's what I believe it was. I had this thought, I remembered, and I had this intuition that coughing can sometimes go along with heart conditions in dogs. Now, if we rewind almost exactly a year, on December 20th, we had both dogs into the vet for their checkups and also their shots. And the vet mentioned that she had a heart murmur and to keep an eye on her resting respiratory rate. So she gave me this little piece of paper and wrote down how many breaths she should be having when she's either resting like this or sleeping. And it needed to be under 35. They actually weren't able to get the number at the vet because when we take her to the vet, she's like a psycho. She's like whining and wandering around. She knows there's other dogs on the other side of the door. So the vet wasn't able to count her breaths herself. So she's like, go home, count her breaths. And I did, and it was under that rate, which was 35. And then a few months later, I kind of did it again, and it was still under that. And then honestly, I forgot to keep doing it. So this day, when I realized, hey, I know sometimes coughing can go along with heart conditions, I should probably check her resting respiratory rate because I haven't done it in a while. So when I counted it the first time, it's supposed to be 30, I don't know if I said that, it's supposed to be 35 in a minute, not just 35 in general, but within a minute's time, it should be 35 or under. So I set a stopwatch for a minute, and when I counted, it was at 48. And then I started to get really alarmed. Set my timer again for a minute, and I counted it, and it was like 47. So then I started to panic, knowing that she now has this cough that could be linked to heart conditions, and also her respiratory rate is well over the 35 it's supposed to be. Of course, Dr. Google or veterinary Google, I started searching on there and basically self-diagnosed her with heart failure. Some of the top symptoms of that I will maybe put right here in case you're worried about your dog. But the coughing and the higher respiratory rate are two of the symptoms of it. So I called into our vet. We go to Corman Park Vet. It's just outside of Saskatoon. We love it there. Very well priced, and we also really like the vets there. So I called the vet. It was Monday morning. I told them what was going on. They couldn't get her in until Thursday. So Thursday came, I took Gracie to the vet, and they listened to her heart. The vet said that her murmur is, quote, really bad. She didn't give me a grade or anything. Now doing research afterwards, I know sometimes they give you grades for murmurs and also heart conditions. She said that is what her coughing is from and asked me if I wanted to do x-rays. And I asked her what the x-rays would do, and she said it would tell us and obviously show us exactly where she's at with her heart condition, and then we would better be able to monitor it from there. So obviously I wanted to get that done. I wanted to know exactly where she was at right now and what we can do for her moving forward, and so we can keep track on whatever is going on. At that point, she just said that she had a bad heart murmur. Now, I'm not a vet. I'm also not a vet tech, so I'm just gonna tell you based on what I think they were saying, what was told to me, etc., but I may be getting some things wrong. So I agreed to do the x-rays. They took her back. Gracie did awesome. She's always really good at the vet, even though she's kind of like anxious and stuff. She's always very patient for what they have to do with her. So they took her back. They did the x-rays, and then they called me into the room so I could actually look at the x-rays. Now I will be putting them up somewhere on the screen here and maybe circling the areas that I'm talking about. And she showed me the x-rays. So what they have diagnosed her with is the very bad heart murmur, and she has an enlarged heart, which together means she is in heart failure from what I understand. So showing me on the screen of her x-ray, her heart is very large and it is also round. She said that the heart, when it's healthy and normal, it should be like a heart shape and smaller than what hers is right now. I do also understand that they usually grade the heart on how bad it is when it's enlarged. On the screen, I think it says like 10.75 or something like that. If anybody is familiar with enlarged hearts or heart failure in dogs and you have knowledge, please let me know what that means. So obviously this diagnosis is not good. She is currently on 5 different meds, which I will put in a clip and go through what meds she's on. So these are Miss Gracie's meds. I mentioned that she was on 5 different meds, but actually one of them she was only on for 7 days. It was I think it was like a Sulcrate Suspension or something. It was something that coated her stomach before I gave her food and these meds. So I think it just kind of helped like wean her onto all of this. So these two, hey Boom, these for your sister? These two are twice a day, every 12 hours, and these two are once a day. So this first one is Furosemide, 20 milligrams. This next one is Vetmedin, 1.25. Now, some of these may possibly be for her vertebrae because I was worried that it was making her uncomfortable. This liquid is Meloxicam. I think this might be the anti-inflammatory for her vertebrae. And then this last one is Enalapril, 5 milligrams. So these are Gracie's current concoctions right now of meds. And if you hear grunting, it's a baby slowly waking up. The diagnosis is not good. The meds that she is on will not reverse anything. It is just, it's not going to reverse or fix what's going on, unfortunately. And it's going to help it progress a little bit slower. So basically the coughing that she's had is because there is fluid and inflammation around her lungs, and there's also fluid in her heart since it is enlarged. So I've already had a lot of time to process this. Sorry. I'm gonna try not to get emotional. I feel like I always cry in videos like this. I've already had a lot of time to process this. It's been over a week. Yesterday it was a week. So obviously this isn't good. She is an older dog, as much as I don't like to admit it to myself, and as much as she doesn't act like it. That's the thing. Other than the coughing and me noticing her breathing in that one moment, she has acted completely fine. She plays like crazy, she runs around like crazy, she's up and down stairs, like she's acting completely normal, still eating, etc. So unfortunately, this is probably what is going to do her in, because it's just going to keep getting worse, and all the meds can do is just slow that down for us. Now, I did ask the vet like how long they think she has, and obviously they can't give us an exact amount of time. It is totally going to depend on each dog. It's going to depend on Gracie and how fast this progresses. But the vet said her answer was like, honestly, like 6 months, a year, maybe a little bit more. It's really hard to say, but we've already decided that we're not going to put Gracie on that timeline. She has been through lots of other health things and come out the other side and completely surprised us. A few years ago, she had bladder stones that they said she would for sure need surgery for. And then in her follow-up appointment, after changing her food and doing lots of Reiki energy sessions on her, her stones had completely dissolved. So we are not setting her to that timeline, but I am also grateful to know what is going on with her so we can slow this down and so we can enjoy our time with her. And like trying to look on the bright side of things, because there's no point being super negative or upset all of the time about this. Trying to look at the positive. I am on maternity leave right now with Everly, and what that means is with her going through all of her health issues and her being on all these different meds, and also her just progressing through this and eventually going to get worse, at least I get to be home with her and I get to enjoy every moment with her. So that is the bright side of the timing of this, is that I get to be home with her every moment. It's also COVID and we're on lockdown right now, so I am not going anywhere. I am like such an introvert that I am having no problem being at home with the dogs and Ev. And I have always wanted to like work from home. So right now making YouTube videos is my work from home, even though I'm on maternity leave. And I always said to Gracie that like before, I don't know why this is making me so emotional. I always said to her, and I always had this goal, that before she died, I wanted to be a stay-at-home dog mom with her and just spoil the heck out of her. And we have Boomer now too, but in like a weird way. This is how I'm able to do that for her. I'm being a stay-at-home dog and human mom while she has to go through her stuff. And so far she's been on the meds for a week and there's been no weird symptoms. The one pill is a diuretic. So they said expect for her to be peeing more, and eventually she might need pee pads in the house. She might be making messes in the house because she can't make it outside, just depending on what happens here with her. But honestly, she can mess in the house all she wants as long as she's comfortable. We're gonna put up with that. And because I'm home, I can let her out a million times a day if she is able to hold it. And that's one thing, I'm just so grateful I'm home right now to be with her. And like I don't know why I'm so upset, because she's like honestly totally fine and totally herself right now. It's just hard knowing that she's going to eventually go downhill, and she is just like such a proud, tough through it. She thinks she's a big dog in a little dog's body, that I know she is probably gonna far exceed the timeline and she is going to surprise us, but I am just so grateful to be home with her. There is a kind of second diagnosis that is totally unrelated to her heart. As you can see, she is long and low, most likely a wiener dog cross. So there is a spot in her vertebrae. I will put the second x-ray up here and circle it. where I think it's vertebrae anyways. I'm trying to remember exactly what they said, where the two are kind of compressing onto each other, and she has what is close to being a slipped disc. So right now she gets around totally fine, but the vet said like one wrong move and that disc could slip and she could not be able to walk, and that would not be a good situation. With her age and her heart condition, she's not going to be able to get put under for surgery. So the unfortunate thing is with Gracie acting totally normal otherwise, running and jumping like crazy like she's a frickin' puppy, now we have to try to limit her exercise because we don't want her to slip this disc and like essentially become paralyzed, and then we not be able to get her in for surgery, and then that would, I guess, be the end of her, sad to say. So completely unrelated to her heart, but it is a good thing that we know this. It's just very hard for us to get Gracie to cooperate in that way, and also we want her to be able to have fun. So it's a very fine line. Looking back, that is exactly why she had trouble jumping up on the bed, and I don't know if you've seen our video, but we made stairs for her up onto the bed, which is good that we have those stairs, so she doesn't have to be jumping that high. We are going to be making a little stair for her to get up on the couch because she loves laying on the couch with us, but she has been having trouble jumping up on the couch. So her back issue is just a combo of her being old and also just her structure. Being a rescue and being long and low, it is not very forgiving on her spine. So yeah, and actually about a year ago when she hurt one of her back legs, I was taking her to rehab, and they actually picked up that in her spine, in like the very middle of it is where it's bothering her, that there was some discomfort. And the rehab girl, this is at Acadia Vet if you're in Saskatoon, she was amazing, but the rehab girl thought that it was arthritis in there. Now the vet said that around that vertebrae it could develop into arthritis and start becoming very painful for her. So I guess the reason that I'm explaining all of this and sharing all of this with you guys is A, because you guys know Gracie and Boomer, you love Gracie and Boomer, and I want to keep you updated. B, I just like being very transparent with you guys and honest. And also C, I guess I'm looking for support. If you have ever had a dog with an enlarged heart, a murmur, in heart failure, if you have any recommendations for me of like foods I can give her, like I'm totally fine with giving her more fresh foods that can help strengthen her heart. I have joined some Facebook groups for dogs with heart failure where people talk about the medications that their dogs are on, what works for their dogs, etc. So that's why I'm going to be sharing that. But thank you guys so much for watching this video. Thank you for loving and caring about my family. I've loved all the well wishes that you've sent us after Everly has been born. And if you guys could just send Gracie some love, I would really, really appreciate it. I truly believe in the power of positivity and the power of energy healing and just sending well wishes somebody's way and keeping them in your thoughts and prayers. So if you could do that for Gracie, I would really, really appreciate it. The other thing that I guess I haven't mentioned is that I have an appointment for her on, I think it's the 31st, and that's a follow-up appointment. So they are going to see how the meds are going for her, and I think also redo the x-ray and see how things are kind of progressing. So as we go along this journey with Gracie, I'm going to keep you guys updated. So I hope maybe in the future these videos can be helpful for anybody going through the same thing with their dogs. I am gonna stop rambling because I feel like this video is gonna be so long. But again, thank you so much for watching. And also, this little one is waking up and gonna eat right away. Thank you so much for watching. If you haven't already, I encourage you to hit that subscribe button down below. I upload videos about dogs, about Everly, about grooming, and now I guess about canine heart failure. I upload new videos every single week. Thanks guys, see you in my next video. Look at this one. Oh my gosh. Also, I will mention Gracie is like completely in love with Everly, and it makes me pretty sad that she's not going to be around long enough for Ev to remember her. Gracie, can you tell the people goodbye? Whoa. Say bye, guys. Thanks for thinking of me. I'm gonna rock this. Bye, guys.